easily binds heavy metals. And usually heavy metals, where do they come from? It comes from what we eat. Okay. So may it be from the produce that you are consuming. So plant foods. It can also heavy metals can also be obtained from seafood, no, like fish, your pork, these food products, but mainly from food, no, the heavy metals. And the heavy metals that accumulates inside our body, especially if you are fat. Okay, heavy metals primarily accumulate inside fatty tissues. Okay, so if that accumulates inside your body, then your body will be under oxidative stress most of the time, of course, with very high heavy metal toxicities. This can be as this can set up an environment to, nurture cancer. Okay, so that's why I always tell patients, okay, after your treatment, you're already on remission. Please be on Simply Nature PPARs for at least the next 6 months. Okay, and I cycle this with other supplements that I use. So I cycle it with, for example, an immune booster, okay, like rice bran. Then after they are on it, then I go back to PPARs. Okay, so why do I cycle? It's also to prevent the cancer cells from getting sensitized or desensitized to these supplements. Okay, so it's to prevent forming resistance. So that's what I usually do. Right. So, but that's just a small portion of what I usually do for patients. But the thing is, after when you are already on remission, actually, even for non-cancer patients, like for us, no, healthy individuals, it's also quite good to take Simply Nature PPARs once in a while, just to cleanse your body of these heavy metals.
Doc, I think this heavy metal thing is something that is very important because those of us who live in cities, especially I live in Metro Manila, I can tell. Doc, I just came back from Taiwan and the air is different.
Yeah,
the air is different.
Right. Some patients, no, I've had encountered before when they go abroad, where the air is cleaner, no. Say for example, yeah, Taiwan is a very clean place, no. When they come back here in the Philippines, those Filipinos are locals, when they come back here in our country, they suddenly develop these allergic coughs, asthmas, no. Yeah, so yeah, it's how dirty our air is. Okay, so these things happen.
Yeah, so I think it's so important that we take some supplements that can actually help us cleanse ourselves of heavy metals. Of course, you can go for chelation treatment, but that is something that is like a treatment. However, with products like Simply Nature PPAR, it's a little bit at a time on a daily basis, right? It's very gentle, it's not like a heavy scrubbing of the heavy metals from your system, but it's something that facilitates your body's own functions to remove all these heavy metals in a daily way, very smooth, very gentle, very gradual. And of course, if you are clean, it keeps you clean, right? You don't need to do heavy scrubbing when you're actually so clean. So I think this is another good point that you brought up. And this is something that is worth looking into when you look for supplements, right? So again, amazing. That's why I think the PPAR tablets are really the best, like all-in-one that you can ever have. And then if you have special needs, you add on top of that. Sheila?
Thank you, Sir Khan. Thank you, Dr. Jansen. All right, so for the next question coming from Ms. Markiel, pwede po ba ang PPARs tablet for perimenopause or menopause?
Yeah, so the question is, can we use PPAR tablets for patients who are undergoing menopause? Definitely yes, no. So for women, although this is a it's a natural part of life, no, that your menstruation will stop. Usually, these women develop hot flashes, problems with their bones, their mood, no, hormonal imbalances. Some of them actually get metabolic syndromes. Okay, some of them develop insulin resistance. Okay, when they go into menopause. So definitely yes, Simply Nature PPARs can help, especially with metabolic issues. And even when you do develop metabolic issues, no, yeah, Simply Nature PPARs can make the medications that you're taking much effective, or the dose would be lower. Okay, so one problem is again insulin resistance. Insulin resistance is the one that leads to diabetes. Okay, and it's also one reason why you develop dyslipidemia. Okay, or high blood cholesterol level, high triglyceride levels. So Simply Nature PPARs is a product that addresses insulin resistance and the high triglyceride levels, even the high cholesterol levels. Okay, so it's actually also quite good for fatty liver disease, right? And fatty liver disease is also one condition that postmenopausal women do get quite often. Okay, so yeah.
Well, good news. That's a good news. Yes, Sir Sean, would you like to add anything?
No, I think it's just goes to show that actually, normally when we choose supplementation, we always think of like, what's the dosage? How concentrated is the vitamin C, the vitamin D? Am I getting a turbo boost of calcium? But there are more things to just your mineral and vitamin level, right? You got to make sure that you're taking supplements that have certain effect. So what's the effect? The effect that we want, we don't just want high vitamin C levels in our body, right? We want our anti-inflammatory responses to be strong. We want to remove chronic inflammation from our body, right? You don't just want to have high calcium in your body, right? You want strong bones. So you got to figure out what will give you actually strong bones. And Dr. Jansen has a great tip on strong bones. You have to do resistance training, right? If you don't do resistance training, you can take all the calcium in the world. You will only end up with kidney stones and not stronger bones. So understanding is very important. So keep the questions coming. I think they're really great, the questions we have tonight. Yeah.
Just very quickly, I just also want to add a little bit. The tablets actually are kind of our help also to our patients, because we understand some of our patients are separately buying calcium and then vitamin A on the side, vitamin E on the side. All these things are actually on our PPARs tablet already. So you might want to explore this tablet of Simply Nature as well. All right. I just want to greet Miss Jeanette Ku of Child House. Good evening, and thank you for joining us tonight. Okay, so for our next question coming from Miss Peregrina Aquino. Hello po. Can PPARs plus tablets help a patient diagnosed with metastatic cervix cancer, stage 3B, or which of your products will help while receiving chemo treatment too? Thanks po.
Okay, first of all, stage 3, please go for a consult with Dr. Jansen, all right? Because your cancer has already begun to spread. So you want a correct, accurate diagnosis, but I'm sure Dr. Jansen can give you a quick recommendation for what he would do in general for his patients in a similar situation. Doc? Doc's on mute.
Okay. So very quick tip, no, since you already have cervical cancer stage 3B, the PPAR product that I think would be quite helpful, I'll give you options, no. Number one, of course, is the liquid, and another one would be the powder. Okay, but you have to pair that with the tablets. Okay, because you're undergoing chemo and radiation therapy. It will destroy the cancer cells quite easily, quite fast actually. And inside the cancer cells are toxic substances that you have to excrete out from your body. So Simply Nature PPARs would definitely be helpful for that. And of course, since it's chemo and radiation, your immune system will definitely go down. These are two products that are really quite good in make sure that your immune system doesn't go down as much, no? It doesn't go down severely. And another benefit that you can get from this is the fatigue that you will experience from chemo and radiation will be lessened. No, why? It's because PPARs is very high in antioxidants. It has very good antioxidant characteristics. Okay, but of course, to know definitely the protocol that would be right for you, make sure you schedule an appointment, no? Because there are other things that we have to address. Okay.
Excellent. Thank you, Sir Sean. Thank you, Dr. Jansen, for that answer for that question. Okay, another question coming from Miss Kalupe Jeffrey. I like that the questions are really coming in, a lot of them about cancer. So for colorectal cancer, which one is the best? PPARs powder or PPARs liquid extract?
Very interesting question. I would say it depends, no? If you have colorectal cancer, depends on whether you have been operated already, you've underwent surgery, how well can you tolerate food as well? Are there any malabsorption that we will be expecting? Do you experience any malabsorptions at all, no? But for colorectal cancer, for us to be really, 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 really safe, I would suggest the powder instead of the liquid. Kasi if you have malabsorptions, then the liquid might not be the best option for you because you won't be able to absorb it, no? Especially if you have metastatic colorectal cancer. But if the cancer is confined to the colon itself, no, then I would choose the liquid because then you can bathe the cancer on the product. Okay? So this is how I would decide, no? But you have to go for a consult to know for sure. So we can know really for sure what which would be more appropriate for you.
Sheila,
So
I
does
saw-
it...
Yeah.
Yes, Sir Shyan?
So again, those of you who need to have a consult with Dr. Jansen, simply just type into the chat that you need a consult. Someone will connect you up with Dr. Jansen. Sheila, I saw a question from Miss Claire Ong. Can children take PPARs if they have leukemia? Sheila, why don't you answer this one?
Well, I understand why Sir Sean threw this question to me because my son is actually a cancer survivor. Not from leukemia, but other type of cancer, which is nasopharyngeal, and that was stage 4 around 5 years ago. And yes, my son was diagnosed with cancer when he was just 4 years old back then. So yes, indeed, we even have patient of Dr. Jansen who was below 1 year old who was able to take PPARs alongside her treatment during her chemotherapy or her cancer journey. So definitely yes.
That was baby Jian, right? So was baby Jian on which protocol was she on? Liquid or powder mixed with water or what?
I believe Dr. Jansen put her on liquid as well, correct, Doc?
Okay. So
it's a mixture of liquid and powder. But primarily, I gave her powder and tablets, then shifted her on liquid, then put her back again on powder.
Yeah, okay. So for Claire, if you want to know, as you can see, Doc Jansen's his protocols are very creative because they are tailored to the individual. So, of course, Doc Jansen can give us specific medical advice because as a doctor, he needs to know your actual case, all right, before he can give you concrete advice. So the things that he is able to share is in general, right? Not specific for a particular patient. So do have a consult with Dr. Jansen. So yeah, because children are Child House, Miss Janet that we greeted right in the beginning of our program. She actually runs a cancer halfway house for kids. So you're in the right company tonight, Miss Claire. So we also sponsored children from Child House who are undergoing chemotherapy at PGH, Philippine General Hospital. So definitely the answer is yes. Please either have a consult or get in touch with either Sheila or Jen so that they can assist you with any more questions you may have so that you can get your child on our protocol and on the way to recovery.
Thank you, sir. Well, what I can say is just we don't want our patients drifting away from their doctors, and we also want you to have a very good relationship with your doctors while you are on your cancer journey. All right. Okay, so for our next question, coming from Miss Donna Maneklang, I'm triple negative breast cancer patient. I just had my first chemotherapy last Monday, cytokase and cyclophosphamide and doxorubin. My onco asked me to stop all food supplements, including PPARs protocol. I just started 2 days ago before chemotherapy. Okay, it's my day 3 after chemo. I have not experienced any side effects, and I wonder whether I would continue with PPARs or not, and if I will follow my oncologist. This is a good.
Yeah, this is actually quite a good news, no? So here's the thing. The reason why oncologist tells you not to take supplements with the chemotherapy is because they can interact. Okay, because how chemotherapy kills cancer cells is by way of free radicals. Free radicals is the one that gives your body oxidative stress, no? So that will damage the DNA of cancer cells. So that's really the idea, no? To kill the cancer cell. However, this will also kill the healthy cells. Okay, that's why you're feeling the side effects. Now, the oncologists, in fairness to them, they are just being careful because they are not well versed on the supplements, on what they do, what they don't do, the way they interact with the chemo. That's why they tell you not to take supplements, especially the herbal ones, because they can interact with the chemotherapy medication. So what I do in for my cancer patients, I tell them to follow the oncologic protocol, the protocol that the oncologist gave, but I make sure that the supplements don't interact with the chemotherapeutic drug. Okay? So, depends on what kind, but the chemotherapies that you mentioned, yeah, you cannot take any antioxidants together with them because the chemotherapy, the free radicals of the chemotherapy will act on the antioxidants instead of the cancer cells. Okay? So what I do, of course, you have to recover, right, to get ready for the next cycle. So what I do is to ask patients to just skip taking the supplements on the day that they will receive chemotherapy, and then you can just continue the following day. No, typically after 24 hours, you can continue already. Now there are chemotherapeutic medications. There are other oncologic protocols wherein you can actually combine everything. They don't have any interactions. Okay? So, but in your case, no, in your case, yeah, it's fine, no. Just take it after 24 hours. Because after 24 hours, the chemotherapy's effect will be there already. It would be full-blown already. And the half-life of most chemotherapeutic drugs is 8 hours, 6 to 8 hours, the half-life. Okay? So it means that after giving it to you, after 6 to 8 hours, the dose of the chemotherapy inside your body will reduce by half already. So we just wait for 24 hours for your system to flush out the chemotherapy. Then you can begin taking the antioxidants, the supplements to help build your body back. Okay? So that's how I
You know,
usually do it.
everyone, this is why I love our program. We don't that's why I love having Dr. Jansen with us. You're not just hearing like, yes, take this is good for you. Dr. Jansen is actually giving us all the necessary information, like how long does your chemotherapy last in your body? How come you can take supplements 8 hours later because the chemotherapy drugs have already reduced by half, and in another 8 more hours they'll be reduced by another half, which means it'll be down to 25%, and after that it'll be only 12.5% in less than 24 hours, right? So these are all knowledge. That's why other doctors, like oncologists, tell you not to take supplements, because most of us buy supplements from either network marketing agents or someone at the health food store. What do they know about chemotherapy, right? Can they really advise you when to take the supplements, even if they are helpful? So this is the reason why your oncologist tells you don't take supplements, because he's afraid of where you are getting your information from. So we are very glad to have Dr. Jansen with us, sharing with us the in-depth knowledge so that you can take your supplement protocols with absolute confidence that it will help you and that it will not counter-interact with whatever treatments your doctor is giving you. Because Dr. Jansen himself is an MD and one that specializes in cancer care. Yeah, Sheila?
Thank you, Sir Sean. All right. Another interesting question coming from Ms. Han Yuri. Is it still necessary for me to undergo surgery even if I'm already taking PPARs? And another question coming from her is that, is there really truth about there's a permanent damage in our organ when we are undergoing chemotherapy?
Very good question. to answer the first one, I have to know what kind of cancer do you have. Is this breast or what kind? She's a candidate for surgery.
Miss Han, you might want to elaborate on your concern.
Anyway, yeah, it's fine, no? So okay. I'll give you a general answer. For nowadays, no, cancer survival is quite high already, especially for breast, prostate, colorectal, lung, and I forgot the other one. But those four cancers, our survival rates is quite high already, especially nowadays. The reason is because of surgery. Okay? When you cut out the tumor, you immediately reduce the tumor burden inside your body. If the headquarters of the tumor is not there inside your body, then the chances of metastasis significantly goes down. Okay? So I highly encourage you to have the surgery if it is indicated for you. There are situations where surgery is not a solution anymore. And that is when the cancer is quite advanced already. Because if the surgeon will remove a locally advanced cancer, then the surgeon would have to remove a larger chunk of your body, which of course you might die, okay, because the surgeon removed a lot of things, no, a lot of organs inside your body. Okay, so if you are a candidate for surgery, go for it. Okay, don't wait, because if you wait, there will come a time when the cancer is advanced already and you want to have the surgery, you cannot have it already. Okay, so I highly encourage you to go for the surgery. And what is the other question, Sheila?
Is it true that chemotherapy damages the organ?
In some cases, yes, but some chemotherapeutic drugs don't do permanent damage to your body. Typically, when chemotherapy does irreversible damage to the body, that is when chemotherapy is given to elderly individuals, because elderly or our senior citizens, no, their body's capacity to recuperate, to restore, to heal is much slower compared to a younger person. Yeah, so in those cases, then we might have irreparable damage, no, because of the chemo. But more often than not, our body finds a way on healing itself. So eventually people do recover. Okay, but some don't, no, and these people would be really quite sick individuals. Okay, that's why we have to really do good cancer support care.
I just want to quickly directly interject over here is that chemotherapy does do damage to healthy organs, which is why if you can protect your healthy organs from chemotherapy damage, then you are able to have the best of both worlds. Because if chemotherapy can damage healthy organs, it can certainly damage the cancer tumor as well. So the strategy is not to avoid chemotherapy completely. What if you can have the killing power of chemotherapy on your cancer tumor and at the same time protect your healthy cells and healthy organs? That's exactly what our Simply Nature PPAR liquids can do. And we're not just saying it like that. We actually tested our Simply Nature PPAR liquid with chemotherapy drugs. Okay, really, I challenge our viewers to find another natural supplement that actually tested themselves with chemotherapy drugs. We tested ourselves with platinum-based chemotherapy drugs, the most commonly used ones like oxaliplatin and cisplatin. These chemotherapy drugs are found in for the treatment of more than 14 different types of cancers. And they're usually used in cancer chemotherapy drug cocktails, right? So if you have a cancer patient undergoing chemotherapy, you probably be using either cisplatin and oxaliplatin at one point or another. So we actually tested it, and it actually protects your bone marrow cells, your red blood cell count, white blood cell count, and your other organs from cytotoxicity damage, which is from chemotherapy damage. So you really can have the best of both worlds. So for this specific patient who has decided or is considering, that means you are open to chemotherapy, here's the good news. You can confidently go into chemotherapy with protection for your healthy organs and cells. Just go for a consult with Dr. Jansen so that he can check exactly what chemotherapy drugs you're going to use and what's the best way to pair up the Simply Nature PPAR protocol to protect yourself through the chemotherapy sessions and also boost your immune system and all the other benefits as well. Right. And a story, Dr. Jansen, very sad story. I came from Taiwan. So one of my friends and his best friend, so his best friend is an acquaintance of mine, had just passed away because originally he was diagnosed with inflammation in his pancreas, and there seemed to have been a small like growth, like the doctor said that it's most likely due to just an inflamed pancreas with some benign growth. So the doctor did suggest to him, it's of enough concern because he's 60 plus that, let's do a biopsy, and if it really is malignant, let's do a surgery and remove it. So this acquaintance of mine, he decided, he's 60 plus, traditional person. He was very worried that at his age, if he went for surgery, what if there were long-term effects, from surgery? So he tried to avoid it. He avoided it for like 2-3 months. There didn't seem to be any physical feeling that he had. So he wasn't so concerned. He just kept delaying it. Then bam, on the 4th month, it was found out that it was pancreatic cancer. And in 1 month, doc, I saw pictures from my friend who took pictures of his best friend, right? Oh my God, doc, he literally became a skeleton. His skin turned black. His cheeks were like that. And he was fat. Before that, he was fat. In 1 month, oh my God, he shrank to just bones and skin. Sheila, he was even thinner than Dominic when you brought Dominic to me. That's because Dominic's face still had, flesh, but this one was really sunken. His eye, wow, it was like looking at a corpse. So I just want to say, when surgery is an option, surgery is a very absolute and quite a thorough, what's that called, way to deal with your cancer. Because while you can still cut it out, you can cut it out. Later, you can't cut it out when it's spread, right? When it's spread, surgery is just not an option anymore. So anyone where surgery is still an option, it's a very powerful option. Now, if you are worried, okay, and I know some people are worried because, many people think that surgeons want to cut you up no matter what. Okay, that's not true, all right? So if you're worried, you can always type in, we'll recommend you a surgeon that we trust so much, Dr. Jimmy Katapia. In fact, during our last face-to-face event in SM Aura, someone asked Dr. Jimmy if he or she needed to go for surgery. Dr. Jimmy asked him more questions and said, no, your condition, you don't have to go for surgery. So if you want a surgeon that you can trust who will really tell you if you need to go and when you don't need to go, just type it in. We'll link you up with Dr. Jimmy Katapia. He's also one of the doctors serving together with Dr. Jansen on SMG. All right. So, and also a plug, right? March 16, in 15 days time, we'll have another face-to-face where you can ask all these questions together with Dr. Jimmy, as oncological surgeon, Dr. Jansen right beside me, beside Dr. Jimmy, all of us together. One question, 3 people from 3 specializations answer you at the same time. So register for the event. It's in SMX Aura on March 16 in the morning. All right. Thank you, Sheila.
Thank you, Sir Shyan. And thank you. It's actually a very common question if they should be going for surgery or it's okay not to go for surgery. And you said it. It's something that I also learned from Doc Jansen. He always says this to his patients: if you are for surgery, you are actually in a very good position. So there. All right. So for our next question coming from Miss Hajime Mashte. Hi. I had chemo and radiotherapy for breast cancer in early 2022. At present, I am taking letrozole 2.5 mg daily, prescribed for 10 years. Luproreline injections monthly, prescribed for 3 years, and Zometa infusions every 6 months, prescribed for 3 years. What type of PPARs tablet is advisable?
Go for the PPARs Plus tablets, the one with resveratrol. Resveratrol is actually a very good phytonutrient to have because, again, it lowers your insulin resistance. It just makes your metabolism work really good. No? So if you want to choose which PPARs tablets you want, I definitely choose the resveratrol, the one with resveratrol, which is PPARs plus, no? Yeah. So there you go. There you go.
Thank you. Thank you, Dr. Jansen. Another question coming from Ms. Rance Regala. Will PPARs be helpful to elderly lung cancer patient? What is the current status of your elderly lung patient, which you have shared last year? And any encouraging improvement po?
Yeah. Yeah. So you remember the lung cancer, no, the elderly lung cancer I shared, no. Actually, I will give you updates on March 16. I should not be divulging this thing now because you might not want to come anymore. So yeah, I'll be that person. So yeah, please come on March 16. Okay, so
Okay,
you'll
but
know
I
what
can
happened
tell from
to the lady.
I can tell from the smile on Doc Jansen's face the information must be positive. But if you want to know what it is, March 16, SMX Aura. Okay, go Sheila.
All right. Thank you, Sir Sean. Thank you, Dr. Jansen. Okay. All right. Just a second. Okay. All right. Coming from Miss Janine Barsaga, pag triple or if the condition is triple negative breast cancer, is there any other alternative other than chemotherapy, radiation, or is it just oral maintenance?
One other option is targeted therapy. However, you have to fit the criteria. No, you have to ask your oncologist if this is even something that can be considered. However, what I know as of now is that for triple negative breast cancer, it's still chemo, radiation, and surgery. No, you can also consider immunotherapy. However, again, it's your oncologist, no, who is the one who will decide whether or not you would be a good candidate for this, no, because testing has to be done, especially for immunotherapy. You have to get tested for PDL1, no. PDL1 is a receptor that if present on the cancer cell, then the cancer will not be detected by the immune system. Okay, so you have to get tested for that. And we actually, to know, no, which oncologic protocol would be effective for you, we actually have a procedure which we call liquid biopsy. Liquid biopsy is just getting 10 ml of your blood and getting it analyzed, no? Analyze it for circulating tumor DNA and testing different oncologic protocols against that circulating tumor DNA and see which one would be effective, which one would not be effective. Okay, so that's how we can decide, no, which treatment would be effective for you. Okay, I've heard some really amazing results with this. No, although liquid biopsy can get quite expensive because the cheapest one you can go for is around, I think, 36,000 to 50,000 peso, okay, per analysis. But it really gives you very valuable information because immediately you would be able to know which treatment would be good for your cancer. Okay, so that's one tip.
Thank you. Thank you, Dr. Shall we proceed with the next question?
Yeah, let's go.
We shall. All right. Okay, so for the next question coming from Ms. Nessie Ocampo, Doc, I have autoimmune disorder and PPARS is helping me a lot with my lungs with scar. I had recently had a blood test and the results are ALT, GPT is 34.6 and uric acid is 437.8. How many PPARS tablets should I take and are there any other foods that are prohibited to eat?
I have to know what kind of autoimmune disease you have. Okay, but your numbers are quite good. I would just, in general, just maintain on the tablets. It would be fine. But for the other advice, I suggest for you to go for a consult. Okay, to be more, so I can give you the a more accurate advice, no. But you're doing quite good. Actually, you're doing quite well. So continue.
Excellent. Thank you. Thank you, Dr. Jansen. Okay, another question coming from Ms. Noemi Veres. Quite interesting because, good evening. Just want to ask how about using cosmetics, for example, lotions and others. Is it advisable for cancer patients? Thanks po.
Well, for those things that you apply on your body, make sure it's fragrance free. Take a look at the ingredients as well. Make sure there's no parabens. Parabens can have been shown to lead to cancer, no? Increase your risk for developing cancer, especially lymphoma. So if you're a cancer patient, then if you're going to use parabens, products with parabens, then yeah, it might stimulate your cancer. Now, when it comes to fragrance, it's actually more for to avoid unnecessary allergic reactions, okay? And fragrance, um, I don't know if I can say this in public. No, I won't say it in public. No, I won't. But the tip is avoid products with fragrance.
Sorry, sir, were you saying something?
I said, Doc Jansen, you can say it at a consult.
Right. Okay. All right. So for our next question coming from, all right, just a second. Okay. Coming from Ms. Nemia Tomasis, I have invasive carcinoma stage 3. How can I order PPARs? That's a good question. May I answer first the last question, and then you go with the condition, doc? All right. Of course, our products are available via Shopee, Lazada, and of course, you can also order directly from our BGC office. And once again, the condition, doc, is I have invasive carcinoma stage 3. What should she order from us? Or there.
Okay, if you have stage 3, definitely order the liquid. But if you're going to order powder, it's also okay. The decision whether to go for the liquid or the powder would depend on other things that you're doing. Okay, and of course your budget. But if I have the budget, definitely go for the liquid. Liquid is the most powerful of all the PPAR products. Definitely pair it with the tablets. Okay.
Thank you, doc.
There you
All
go,
right.
same advice.
Thank you, Sir Fan. All right, another question coming from Ms. Jeneline Jacobe, a nurse from Cebu. At what stage of cancer do we usually use immunotherapy?
Very, very good question. Yeah, so for immunotherapy, we usually reserve that for advanced cancers already. You know why? Because it's too damn expensive. It's too damn expensive. Okay. If you use immunotherapy first, it might be unnecessary because there are cheaper options, which might be as effective. Okay, but yeah, we usually reserve immunotherapy for more advanced cancers, no, because for more advanced cancers, options are limited as well. So one of the products or one of the treatment that would be quite effective for advanced cancers would be immunotherapy. Okay, so there are clinical trials that have been quite promising. There is one that was released a year ago, which was for colorectal cancer, no? So the name of the drug that they studied is dostarlimab. That's also immunotherapy, similar to pembrolizumab, no? And what this medication did for the patients with colorectal cancer was that they had 100% recovery. So it's quite amazing. Okay, so but remember, no, you have to be a candidate to receive this drug. So one criteria is you should be PDL1 positive. Okay, so yeah, because these immunotherapy, no, pembrolizumab, dostarlimab, are PDL1 inhibitors. They inhibit this receptor that is found in cancer cells. Okay.
Okay, thank you, Dr. Jansen. All right, on to our next question coming from Ms. Jenjen Sumapal. How to prevent having high cholesterol? Is it dangerous for me if I can't lower my cholesterol? I think she's talking about PPARs, if she can take it to prevent high cholesterol.
Definitely, you know, we did pilot trial, and we were actually doing it to check for its effects on high blood cholesterol. And yeah, for even very high blood cholesterols, usually between 1 month to 3 months, it will gradually come down and normalize. All right. So, however, you know, you can't, even though PPAR works for high blood cholesterol, you can't be taking PPAR tablets and eating like me a stick of butter every day, all right? You can't do that, all right? You still gotta work with the product, all right? Don't work against your protocols, okay? But yes, it can help with your cholesterol. In fact, that's one of the things that we, in other countries, in Philippines, we can't simply because of Philippine law. But in Taiwan, we actually make therapeutic claims for high blood cholesterol and high blood sugar. We can lower high blood cholesterol and high blood sugar within 1 to 3 months, and we make that as a therapeutic claim in Taiwan. But of course, in other countries, every country's laws are different. So many countries don't allow natural products to make therapeutic claims. So we can't do that here in Philippines, right? Yeah. But yeah, in Taiwan we can. Sheila?
Thank you, Sir Shyan. Thank you, Dr. Jansen. Another question coming from Ms. Gwen Carino. Doc, good evening po. Is it normal to have hips and leg pain after all the treatment with cervical cancer? Not to mention, there's also pain in muscles under the buttocks or butt.
So yeah, definitely the answer is yes, no. So that can be an effect of the chemotherapy and of course the radiation therapy that you just received. But you have to be careful, no, because the pain that you are feeling might be coming from the tumor. So you have to get yourself checked, no, for this. So how do you get yourself checked? It's through imaging, CT scan, PET scan, or MRI. So whichever your onco requested. I can do the analysis for you as well, but yes, just schedule the consult. But if you're feeling pain, no, yes, definitely it can be coming from the treatment that you have had, no, chemo, the radiation, but it can also come from the cancer itself. Okay.
Okay, Sheila, I want to answer this because Aquino actually said that he's waiting for, Friends is waiting for the answer. Okay. The answer is, the question is PPAR Plus tablets good for hyperthyroidism and tuberculosis? Okay, the answer for tuberculosis is yes. Why? It boosts your immune system. And tuberculosis often happens in diabetic patients, right? So because diabetes also lowers your immune system, and since 30% of the population carry tuberculosis bacteria in our lungs, when your immune system drops, the tuberculosis manifests. So many diabetic patients also suffer from tuberculosis. So this PPAR tablets plus will actually kill 2 birds with 1 stone and improve your immune system to fight back the tuberculosis. But of course, with tuberculosis, there are specific antibiotics that you should take, and you should take them, all right? Because that's a direct and effective way to do so. But of course, by taking PPAR tablets, you're going to boost, help the process, and it will help manage your blood sugar level, which is one of the reasons why your tuberculosis manifests. For hyperthyroidism, that is something that needs to be monitored, okay? Because PPAR tablets, I guess it is not, it can, over a period of time, it can improve, okay? But if you really want to see improvement, you might want to go for the extract powder or soft gels. However, with hyperthyroidism, my experience is patients do go through quite a lot of Herxheimer, what's that called? Reactions. So for example, if you're hyperthyroid and you take PPAR extracts, you might have experienced days of fever and things like that. So for hyperthyroidism, I would advise that you go and consult with Dr. Jansen so that you have a doctor that is advising you through that process, okay? For tuberculosis, you can take the tuberculosis medicine your doctor prescribes to you and then take PPAR Plus tablets, all right? But for the hyperthyroidism, do make a consult with Dr. Jansen because you will go through some difficulty as you use the extracts. There will be, your body will react as it tries to correct the issue, okay? So I don't want you to be afraid. I want you to always have a doctor on hand that can answer and assure you and let you know what's happening, all right?
Thank you, Sir Shyan. For those of you who wish to have a consult with Dr. Jansen Kalalan, the link for you to schedule or book an appointment is in the description box, or just type in how to consult. Miss Beth of SMG will definitely get in touch with you right away. All right. So for our next question coming from Ms. Dalia Lorenzo, I am a metastatic breast cancer patient under treatment with anastrozole and palbociclib, 75 milligrams. My experience with palbo was my WBC count is dropping whenever I take palbo. Any recommendations on this concern?
Yeah, that's actually a very common side effect of palbociclib. WBC counts usually go down. My suggestion is, of course, you would need immune boosters. Here's a strategy, that you might consider. You can start with Simply Nature PPARs. Take it for 12 weeks. You have your CBC checked again after. See if it increase. Then you can cycle with other immune booster supplements as well, and make sure to eat mushrooms every day. Okay. Usually I cycle it in 3 months, for this. However, if Simply Nature PPARs liquid is already working for you, then just stay on it. Okay, as long as you can. If you can afford it, then it would be best. However, if not, we can go for the powder instead. Okay, but the powder's dose has to be the equivalent of 1 vial of liquid, which is around 10 to 12 scoops per day. Okay, so that's how it is for palbociclib. Yeah, and make sure to go for a consult as well, because we have to look into the other health aspects that might be causing the decrease in the WBC count. So we might need other supplements as well. Okay, so yeah.
Thank you, Dr. Jansen. Sir Sean, would you like to add anything?
No, I'm just loving tonight's questions because they're very specific. And obviously, I can tell from Dr. Jansen's answer that the people who ask these questions are on their way to a solution, right? There's clear direction, understanding, and advice. So I pray that those who ask the questions act upon it. Dr. Jansen and I personally believe when it comes to cancer, don't wait. I just shared a few minutes ago about a story of an acquaintance of mine, the best friend of a friend of mine from Taiwan, who just waited, thought that everything is okay on the surface, and then suddenly his pancreatic inflammation became pancreatic cancer, and in less than 2 months, he became a skeleton, and then he passed on. So it was so fast, so rapid, there was nothing they could do. So don't reach that point. Cancer is something that you shouldn't ignore. Once you have advice and it makes sense to you, take action. All right. So first thing you can do tonight is to straight away book a consult with Dr. Jansen for those who need to go for consult. For those who don't, who need to avail the products, type in and find out more, ask questions. If you ask the right questions so that you get the answers for your solution. Yeah.
Well said. Thank you, Sir Sean. Thank you, Dr. Jansen. All right. Another interesting question. I think this will be our few last questions coming from Ms. Christine Banog. Is eating soya prohibited to breast cancer patients since it is a plant estrogen?
Okay, you have to eat soy products when you have breast cancer. So estrogens, while it's true estrogen can stimulate the growth of breast cancer, it's the animal form of estrogen that can do this. So plant estrogens or your phytoestrogens, they have a different molecular structure than the animal estrogen. Okay, and genistein, which is your phytoestrogen, genistein is actually quite protective against breast cancer. So how does it protect against breast cancer? It's through this mechanism, okay? So for inside our body, we have two kinds of estrogen receptor. So you have your alpha, you have your beta estrogen receptor. The ones that breast cancer cells have are estrogen alpha receptors, okay? And animal estrogen, your estrogen, the ones that our body produces, and the ones that we consume from dairy stimulates the estrogen alpha receptors. Genistein or your phytoestrogens, soy isoflavones, okay, these stimulate the estrogen beta receptors, which is mainly found in your uterus, in your bones. So it's largely protective for your bones. It's actually bone forming. Although it can also attach to the estrogen receptors, estrogen alpha receptors, to some degree. However, if it attaches, it does not stimulate the growth. Instead, it blocks the animal estrogen from attaching to that estrogen alpha receptor. So in a way, it blocks the effect of your own estrogen on the cancer cell. Okay, so that's how it mainly works. Here's another very interesting fact, no? There will come a time that if you eat large amounts of large amounts of soy products, no, plenty enough of it, it can stimulate the estrogen alpha receptors already. But that limit is 16 liters of soy milk. 16 liters of soy milk, okay? So that's how much you should consume for it to stimulate the estrogen alpha receptor. So I don't think anybody can consume that much. I mean, when it comes to water, we only can consume 4 liters in a day. So 16, I mean, that's 4 times of what average individuals drink already. Okay, so yeah, please eat your soy foods because in population studies as well, breast cancer patients who consume soy and who are undergoing chemotherapy, they have a longer life expectancy. They also found that they have they can better tolerate the side effect of the chemo and cancer, the cancer itself, no, they have lower recurrence rates compared to those who don't consume soy. Okay, there you have it.
Thank you, sir. Thank you, Dr. Jansen. Okay, I guess this will be our last question for tonight. Coming from Mr. Raymond Roda, thrown to us privately. The question is, what are the side effects of PPARs? Are there any?
I will answer that one since I'm the PPAR expert. Okay, there isn't actually. Okay, so to rest assured, I did a presentation in Bacolod to one of the cancer centers there. So of course, my audience are all doctors, and they asked this particular question, right? Because when drugs are really known for, drugs do have long-term side effects, right? So in the drug almanac or like in MIMS, it's very clear every drug, what are the side effects and how doctors are to be careful with the dosages and everything. So with PPARs, there is no long-term side effect. How do we know? We actually did an LD50 test, which is a lethal dosage 50 times. And it proved that we have no long-term toxicity build up. So that means even if you eat PPAR tablets a lot every day, liquid a lot every day, it doesn't build up in your body. Your body displaces it, all right? So there is no toxicity. Okay, tonight we actually had a particular case where I said that you should be concerned. For example, hyperthyroidism. You should have a doctor like Dr. Jansen with you if you're approaching it as a natural way to manage your hyperthyroidism. So this is not a side effect of the PPARs. It is the effect of the PPARs working. Okay, so because the PPARs is working, the body will actually react for those specific cases. And how shall we say? It's like, imagine you go physiotherapy, right? Let me ask you. Let's say you injure yourself and you go for a physiotherapy. Your first few sessions of physiotherapy will be very painful, right? And depending on the injury that you had, but you have your physiotherapist beside you, all right, to guide you through so that you will build up your muscles correctly. So that is what's happening when it comes to patients with conditions like hyperthyroidism. The process is a bit more, I guess, intense, and I don't want patients and customers using PPAR products to be alarmed and not know how to react. Okay, but in general, your question is, if you take PPAR tablets, is there any long-term side effects? The answer is no. Are there any contraindication with medicine? No. Dr. Jansen will share with you, for certain chemotherapy drugs, we don't take it together, not because there is contraindication that will lead to negative side effects. It's because for those particular chemotherapy drugs, PPAR does such a great job of protecting your body. It actually it lessens the impact of the chemotherapy drug. So you want to feel the full force of the chemotherapy drugs for that first 16 hours, right? So that's why you don't take it together. Okay, it's not because they come together and clash and create another poison. No, it doesn't do that. And for the long-term side effect, let me share with you, I've been taking PPAR tablets since 2001. So I've been taking it for 23 years, almost non-stop every day. There was a period of about 1.5 years which I didn't take it. But the last 14, 15 years, I've been taking it every day. And the side effect is anti-aging. I'm 50 years old this year. Hopefully, I look just like an older brother to Dr. Jansen, but actually I can be his uncle. Okay, so that's the good news. All right, so I hope on that slightly fun note, we can end tonight's Q&A.
Thank you, Sir Sean. Guys, thank to all of you who watched our webinar for tonight. We would like to say thank you for throwing your questions. Some of the questions, I believe, sir, were actually helping out their fellow patients. And I love the fact that we are creating this community of patients here in Simply Nature and helping each other in their health journeys together. So thank you so much for your questions. And of course, just before we say goodbye to our viewers, may I ask for a very quick parting words from each of you? Who would like to start off? Shall we start off with Dr. Jansen?
So just a few advices, no, for all of you guys. The cancer journey, the treatment of cancer patient does not start and end with your chemotherapy, with your surgery, with your radiation therapy, no. It goes well beyond those treatment procedures. And more often than not, of course, the oncologists would only be, more focused on those on that period of time. Of course, they follow up, they take care of you even after those treatment, they monitor you. You still do need them, but they would just be, looking at you from at a distance, try to see if the cancer comes back. Okay, so my role then would be a more proactive approach. I would have to, make sure that the cancer does not come back. So there are a lot of factors that we have to consider when it comes to that. Of course, number one is to make sure that your body remains healthy. Okay, because in the first place, why you develop cancer, no, it was because of a very unhealthy body. Okay, so we have to restore that health as much as we can. Okay, and that's through detoxification, a lot of supplements that you would have to take, no. So expect these things to happen in your journey in fighting cancer. Okay, so but nevertheless, don't lose hope. There's always something that we can do, even if you're in a situation where if you do this, it'll harm your body. If you don't do that, it'll harm your body. Okay, don't give up, hope. Okay, there's always something that we can do for you. May it be, of course, non-oncologic. Just to make sure that your body's healthy. At least we're doing something. Okay, so that would be it for me. I'll give the floor to Shan.
Once again, thank you everyone for staying. Wow, it is 9 p.m. right now. Still have such a strong viewership. Thank you for your support. And tonight's questions were wonderful, brought up many learning lessons and opportunity for us to share. Please encourage your friends, especially those who will benefit from the Ask Me Anything AMA. I think this is the most lively part and most fun part of our program. We've been doing this for almost 3 years straight now. More than 150 episodes already, I believe. So this is great. Thank you once again. Don't forget this month, March 16, you get to see all of us live, all right? With panelists of surgeon, specialists, everybody together. It's so nice to ask doctors and specialists all at one shot just to see whether their answers will match, right? So we brought together all the experts for you to ask your questions. Our attendees enjoyed it so much the last time we did it in last year in October. So we will be planning to do this every quarter this year. So we'll start off in March. So I hope to see everyone and see everybody again next Thursday. Hand the time back to you, Sheila. Sheila, you're muted, Sheila.
Thank you, Sir Sean. Sorry. All right. Well, once again, thank you, Sir Sean and Dr. Jansen, for answering our questions, the questions of our viewers for tonight. And of course, we hope to see you once again and to answer some more questions next week. Okay, because next week I would like to invite everybody for our next webinar entitled "Breaking Down colorectal cancer, risk factor symptoms, treatment, and prevention. That's happening at March 7, Thursday, at also 7:30 p.m. So, of course, our much awaited March 16 event is upcoming. Okay, and at this point, I'd like to call all our cancer patients, survivors, and advocates. Let us all come together to explore the latest advancement in cancer treatment and engage in a multidisciplinary experts dedicated to enhancing your well-being. Happening this March 16 at SMX SM Aura, limited stocks only. So don't miss out on this opportunity to be a part of the transformative experience. Reserve your seat, bring your friends, and let's embark on a journey to a healthier and happier you. Only 150 pesos for a ticket, either on the site or face-to-face in SMX Aura or online via Zoom webinar if you're outside Metro Manila. So yes, we've heard your request. You can now buy your tickets using GCash. Just scan the QR code shown on your screens and send us the receipt via Facebook Messenger, and we will be the one reserving the seat for you. There you go. All right, well, we once again would like to say thank you for watching our webinars for tonight, and we hope to see you once again in our next webinars to come, because here in Simply Nature, we are always with you from start to healing. Thank you, everybody. Good night, and God bless you all.
There's a miracle in this Simply Nature.
Marami po akong natutunan dito sa seminar na ito.
I would recommend it to people who have illnesses, even cancer.
We are always with you from start to healing.
Hi, this is Shyan, and I'm here to update you with a quick teaser. October 14th of 2023, we had our very first post-pandemic face-to-face conference on cancer, and it was a smash hit. The participants loved the ability to ask our panelists of myself, Dr. Jansen, our expert in lifestyle medicine, and Dr. Jimmy Katapia, who's our oncological surgeon. They were able to get all the answers they wanted about cancer and whether or not to go for surgery. So we are planning in 2024 another session by popular demand, because everyone wanted us to have another one so that they can bring their friends. So a quick teaser, we're going to have back Dr. Jansen, Dr. Jimmy Katapia, so all of you with questions on chemotherapy, on surgery, the doctors and the panelists are there to answer your question. And we have an upcoming special guest. We are hoping to get someone who is going to be an expert on diagnosis, something as very interesting like liquid biopsy, all right? So that's something new and on the cutting edge of cancer diagnostics. So those of you who could not make it for our face-to-face, well, this time round in 2024 on March 16th, we're gonna do ours with a Zoom option. So those of you who are in the province who can't join us here in Metro Manila, look out for the details so that you can join us on the Zoomcast.